Hi, Michele Kunz here. I would like to talk about your Pediatric Advanced Life Support Program class. So you're scheduled to take a PALS program. You definitely want to be prepared before you go. Now there is a PALS textbook. It's big, very interesting. If you're taking one of my PALS classes, remember to download the study guide, and it's a very focused study guide on what you need to know for PALS. It talks about, all the algorithms. It talks about all the cardiac arrest issues. But the Pediatric Advanced Life Support Program, the focus really is assessment, reassessment, airway, airway, airway. It's really to prevent cardiac arrest. And of course there is the cardiac arrest algorithms, and everything we do in the PALS program, if it's related to drugs, if it's related to equipment, it's all by the infant or child's size. So that's what makes it a little stressful, the program, because not only do we have to remember drug doses by weight, you have to make sure that you're calculating properly. So when you take the PALS program, or my PALS program, we will practice over and over again with different sizes or age groups, really the weight, of different children's weights, and make sure that we can get a comfort level with the drugs and the doses and the equipment. So when you take your PALS program, you're going to come to class prepared because you have the textbook, perhaps my study guide, and you've studied. You've memorized the study guide. When you come into the room when you're taking your PALS class, wherever you take it, the instructor will often ask you for your BCLS card and your PALS card. Certainly you'll have a PALS card if you've taken PALS before, but if it's your first time, just make sure you have your BCLS card with you. Be prepared to be proficient in BCLS skills in any American Heart Association course that you take. It is part of the program, as well as knowing how to put the pads on and working with the AED. That's the automatic external defibrillator. Also, like I said, it's really hands-on with all the tools you need to care for a neonate, infant, or child in a near arrest or an arrest situation. We'll be working with, airway equipment, intubation equipment, IV equipment, intraosseous equipment. So it's all part of that mega code also. So you'll have hands-on experience with pretty much learning how to use the devices, and then you'll put all together with the DVDs that they play in the class, if there was an additional slideshow, and the equipment practice. It all gets put together in what we call the mega code, and which is usually in a team. Some instructors might test you individually or in a small group to see how the team would react to certain situations. So be prepared to perform in a mega code. And of course, there's always a written exam, and there's a passing score for that. So the written exam isn't terribly difficult, but you need to know your material. Certainly there is always remediation in the American Heart Association programs, but as long as you come prepared, you'll do fine. If you have any questions about the PALS program or the ACLS programs or even the basic cardiac life support programs, feel free to email me or call me, and you know where I am at my website. So thank you for your time, and I hope this has been helpful.